and springs that we have in Ohio, you should supplement with vitamin D. I think everybody should. You know, if you're in the summertime, if you're outside, you don't wear sunscreens, and you have 20 to 30 minutes of exposure to large portions of your skin, your body can make vitamin D. But I even think then, because we wear sunscreens, we wear clothing where just our hands and our head are exposed, you know, vitamin D is a must all year long. Magnesium is important. You know, magnesium is involved in 300 different chemical processes in our body. So it's important for everything, not just the brain. Zinc's important. And there are some other neurotransmitters, serotonin, GABA, dopamine, acetylcholine, are all important. So whether the condition is, you know, depression or anxiety or memory problems or ADD, ADHD, all these supplements actually help improve the production of those neurotransmitters. And I also, on these little things I wrote out here, I talk about depression. You know, that's just kind of a general cookbook plan for depression. A cookbook for anxiety, some supplements that help with that. A cookbook for memory problems. A cookbook for ADD or ADHD, along with diet and exercise. This is an FYI. You know, exercise is important. And again, I could spend an hour on each one of these areas, but I won't. Exercise 3 to 5 times a week is important. And if you don't exercise, you just get out and walk around the block. That's a start. And eventually, if you can go to the gym, that's even better. You know, one thing that's really cool is Contours Express down here with Marcy's place. She just turned that into a 24-hour gym. And so you can go there anytime you want to. It's women only, so we guys can't go, which is probably good. But anyway, she'll spend an hour with you, and she'll go through how to use the equipment in that place. You can go anytime during the day or night that you want to. She is offering a special right now where I have no interest in this gym. I like Marcy, and she really cares about her clients. But offering a 25 or 50% discount on her initiation fee, so it's only $25, and that includes her walking you through the gym, showing you how to use all the equipment. She also offers no contract, so it's $25 a month. You can join for 1 month or 10. So if you're interested, I think we have some flyers or coupons someplace. Just tell her, because it might be a good thing to go down and do. You can go 2 o'clock in the morning if you want to.
Then I'd be impacting your sleep. Sleep's important.
Right, you want to get your 8 or 9 hours of sleep. It should be number 10 on you. So anyway, relaxation is important. Sleep. You know, you should sleep 8 to 9 hours a week. You should do deep breathing exercises for relaxation. You should do mindfulness. You should do yoga. You should do Tai Chi. Anything to get you away from your daily, normal, stressful routine helps your brain work better. It helps your adrenal glands work better. It helps your whole body work better. It helps blood sugar metabolism better. It helps your heart. It helps everything. So it's important to take time during the day to relax. You know, balancing hormones is extremely important. We've talked a lot about hormones over the past several weeks. You know, we do solid-body hormone testing. You do blood serum hormone testing. But if your hormones are out of balance, and remember, hormones tell cells to do something. So if you don't have the proper balancing your hormones, your cells aren't going to do what they're supposed to do, and they're not going to function normally. So if they're not functioning normally, it sets a stage, you know, for a disease state, or at least a state of chronic inflammation or chronic dysfunction, which can also lead to cell death and a variety of different diseases. You know, reducing inflammation we talked about. An anti-inflammatory diet's a good choice for that. Detox processes. You know, eat cruciferous vegetables. And, you know, the cruciferous vegetables have sulfur in it. You know, broccoli, cauliflower, cabbage, onions. What did I say? Garlic, Brussels sprouts. What else is cruciferous? I said cabbage, cauliflower, broccoli, Brussels sprouts. Incorporate those into your diet every day. Eat one, because that helps your liver work better. Got sulfur in it. Helps your body produce another antioxidant called glutathione. Improving digestion. You know, we talked about that briefly earlier. You know, you can take enzymes to help break down food properly. What we find out a lot of times with patients that are chronically ill, chronically sick, or just getting older, is their pancreas or their stomach isn't producing enough enzyme to break the food down properly. You know, we also find too that because of eating processed food or eating foods that aren't necessarily that nutritious, our small intestine gets very unhealthy. And again, that's where most of the nutrients in your body are absorbed, in your small intestine. So it's important to have a good, strong small intestine, and taking prebiotics help to do that. Probiotics, you know, is basically a bacteria that helps the large intestine function normally. You know, in our large intestine, we have good bacteria, we got bad bacteria. We always want to make sure the good bacteria overrides the bad bacteria. It keeps the bad bacteria in check. Because again, our part of our immune system is controlled by our large intestine. new neurotransmitters that affect the brain are controlled by the neurotransmitters. Minerals are also absorbed in the large intestine. So taking probiotics are important. If you ever take antibiotic therapy, you should always follow it with a course of probiotics. Every time. Because the antibiotics just knock out the normal bacterial flora in your large intestine. Probiotics are important as well. We talked about 18 hydrochloride or hydrochloric acid. The parietal cells in your stomach make that kind of acid and help break down foodstuffs properly so your body can absorb it in your small intestine. And of course, drink plenty of water. That's a quick glance. And as you can see, you need to fix your brain before it breaks. So in other words, you need a healthier body to have a healthy brain. Yeah. You can ask, now we do questions, which I'd rather do anyway. Any questions about it? That's fast, I know.
I'm scared. So far, pretty good.
So far, good.
Good. But I'm scared
Good.
anytime, my age, all time,
You're good right now. You're sharp as a tack. You've taken good care of your body, so your brain's good.
Yeah, so far, very good, but you never know.
Right. That's why you have to take care of your body now.
Yeah, but sometimes they say for younger people, old people, I like
Yeah,
Japanese
some,
TV,
yes.
you get their shock. You know, if you have
Very young
life,
start.
shock come in, you know, something like me, like my husband passed.
Like a stressor, right, in your life. That can be a
Yeah.
trigger mechanism. to
Yeah,
cause
then
it.
they
Right.
cause you all the time too.
Right, because that's that high dose stress affects your adrenal glands and how your adrenals function. You know, one thing with stress and cortisol production, you know, cortisol is a hormone that in normal levels is a good hormone. But in excessive levels, because of chronic or excessive amount of stress, it becomes almost a pollutant or a toxic to your cerebellum and the hippocampus in your brain. And those parts of your brain, those are memory centers in your brain. Those are focus centers in your brain. So if you're under a lot of stress, you got to look at what the adrenal glands are doing, because you can do a lot of other treatment with brain, but if you don't fix what's causing the problem, excess amount of cortisol that's affecting your brain, you're never going to fix the problem.
Yeah.
I think I started maybe might be losing a little by little.
You think? A little by little? We're probably all a little by little. You know, one thing that we've started doing recently, and because for some reason I've seen more and more patients that have depression problems, anxiety problems, autism problems, mental focus problems, is that most of these patients are being treated right now with anti-anxiety drugs or antidepressant medications. And, you know, and a lot of those drugs are all designed, as your body produces these neurotransmitters, it blocks the reuptake of those neurotransmitters in the neurons or nerves in the cells. You know, so it doesn't make any sense to me to do that. You know, to me it makes more sense, let's just improve the production of these neurotransmitters and not try to do some things to prevent the reuptake. Problem with a lot of the medications, they cause a lot of side effects. So patients come to me and say, you know, I don't like the side effects. I don't like being moody or irritable. I don't like being lethargic or tired. I don't like not having sex. You know, so they want to get away from these things. So what we've started doing, and there's a company called Neuroscience that actually through urine can measure the neurotransmitters that you're expelling in your body. So based on that information, we can actually determine what neurotransmitters are deficient. So if we know we have a serotonin problem, for example, that's causing our depression problems, then, you know, maybe we could take some of these supplements, omega-3s, tryptophan, phosphatidylcholine, serine, B6, B12, and folic acid, to actually improve the body's ability to improve the production of these neurotransmitters. Now we would do that once we got the rest of the body working better first. And if that didn't fix the problem, then maybe